Good evening, everybody, and thank you so much for attending our UAB Urology Men's Health webinar tonight discussing erectile dysfunction and treatment options. I want to thank you all for being here. I'm just going to introduce myself really quick and we'll jump right into it. I'm Dr. Adam Baumgarten. I did my medical training, my medical school and urology residency down in Tampa at the University of South Florida. Then I went on to do a year of fellowship, which is a year of extra training, specifically in men's health, erectile dysfunction, as well as urologic reconstruction at the University of University of Texas Southwestern in Dallas, Texas. And before we get started, just want to point your attention to the chat box that you see here on the right. If you have any questions throughout the presentation, please feel free to jot a question down and put it in the chat box, and I will do my best to get it to those at the end of the presentation. All right, so tonight, here's the agenda for tonight. First, we're going to talk just about basic erectile dysfunction. What is it? What causes it? Then we're going to dive into the treatment options. And then, like I said, I'll take some questions. So what is erectile dysfunction? The definition for erectile dysfunction is the consistent inability to sustain an erection sufficient for intercourse. It can come in a lot of different presentations. So one could be just a total inability to get an erection, but others could also be, an inconsistent ability to get an erection that's rigid enough for penetration. Or a lot of men come in complaining about they're able to get an erection, but they lose their erection during or before intercourse. And these are all different presentations for erectile dysfunction. So let's talk just about some facts. Erectile dysfunction is very, very common. About 1 in 4 men will experience erectile dysfunction throughout their life. And right now, anytime in the United States, about 30 million men suffer from erectile dysfunction. It's not normal. So, a lot of people say, oh, I'm just getting older. It must be just normal aging, but that's not necessarily true. As men age, they start to get more medical issues that can affect their erections, but it's not necessarily normal to have erectile dysfunction. And in most cases, erectile dysfunction could be overcome with some form of treatment. So going back to the basics, how does an erection work? An erection is an involuntary reaction in response to sexual stimulation and excitement. And what happens, there's a lot of moving parts. The sexual stimulation and excitement causes the brain, the nerves, the blood vessels, the heart, and hormones to work together to produce a rapid increase in the amount of blood that flow to the penis. The blood becomes trapped in the 2 spongy chambers that you see here called the erectile bodies, and that produces a rigid, firm, and elongated erection. And when any of those things don't work together, the brain, the heart, the blood vessels, the hormones, this can result in erectile dysfunction. So let's talk about some of the causes of erectile dysfunction. Research shows that 80% of men suffering from ED can trace it to some physical problem or disorder. Some of those you see here: injuries like a brain or spinal cord injury, diseases, and this is what we commonly see: diabetes, high blood pressure, heart disease, high cholesterol, all very common. Some men have erectile dysfunction following an operation, such as a prostatectomy, or where the prostate gland is removed. Others after colorectal surgeries, or any surgery in the pelvis or to the spine or things like that can cause erectile dysfunction. And lastly, substance use. So tobacco, drugs. There's some medications that can contribute to erectile dysfunction. And we'll touch on these as we go along this presentation. So what are some risk factors for erectile dysfunction? Here you see, chronic diseases are the thing we see most commonly in clinic, diabetes being the #1 risk factor, making men 4 times more likely to have erectile dysfunction. Others include cardiac issues, high cholesterol, also high blood pressure. So talking about prostate cancer itself is not going to cause erectile dysfunction, but the treatment options that we offer, such as removing the prostate or giving men radiation for prostate cancer, can cause erectile dysfunction. And that's because, as you see here, the nerves that help stimulate erections run right on top of the prostate. Also, the blood vessels run very close to the prostate that supply the penis for an erection. And these can be injured or damaged with removing the prostate or giving radiation. So next, let's touch on diabetes and high blood pressure. These are very common, and we see these very frequently in our patients. If a man has diabetes, that doesn't necessarily mean he's going to develop erectile dysfunction. He's just more likely. If he's older age with diabetes, if he's had diabetes for a longer period of time, if he has poor sugar control, these are all higher risk factors for erectile dysfunction. High blood pressure or hypertension is very, very common. And you can see here, 68% of men that have high blood pressure in this study reported some erectile dysfunction, 45% of those being severe erectile dysfunction. Moving on to the heart, the penis is a vascular organ. So they have very small vessels that supply the penis that come from the heart. And obviously those small vessels are the first ones to go or to be affected when someone has cardiac issues. So some men come in with erectile dysfunction and eventually we diagnose them with some kind of cardiac issue. So as we talked about, aging itself does not affect erections, but as you age, there's a progressive decline in sexual, physiologic, or psychologic function. As men get older, they have more chronic diseases, which can affect erections. There can be relationship and partner issues or psychological issues. Touching on smoking and medication, if a man smokes, he's at least 2 times more likely to have erectile dysfunction. And medications such as a thiazide diuretic or beta blockers, these are both cardiac or heart medications. Also, there's some medications for depression that can affect erections. So let's talk about the treatment options for erectile dysfunction. Most men have heard of oral drug therapy. The most common drugs we use are sildenafil and tadalafil, which the brand names are Viagra and Cialis. You may have heard of these as those. They don't necessarily automatically give a man erection, but what they do is they promote blood flow to the penis. When there is stimulation, this can help induce an erection. In about 70% of men, these will help cause erections, but 30% of men, these will not be effective. We recommend men take these at least half an hour to an hour before they want to be sexually active. And there are certain medications that your doctor or urologist can go over with you that would make you not a candidate for these. Potential side effects include headaches, blushing, upset stomach. It can change some men's vision temporarily, or back pain or muscle aches. Next is a vacuum erection device. The nice thing about this is that it's non-invasive, but there are some disadvantages as well that we'll talk about. Basically, it's a device that goes over the penis. It's pumped up and it brings blood into the penis. Then a ring is placed at the base of the penis to trap that blood in the penis and not allow it to go out during intercourse. Some of the advantages, it's non-invasive and on demand. It's cost effective because once you purchase the vacuum erection device, there's no other costs. And there's training available on how to use it. Some disadvantages that men commonly complain of is the erection's not warm to touch. It can be uncomfortable, and sometimes ejaculation is just not possible with this. Next, we'll go to penile injection therapy. And what that is injecting a medication into the penis to help induce an erection. Some men have also heard of this called ICI or intracavernosal injection, and that's all the same thing. This will, unlike the pills, this will automatically give you an erection about 5 to 20 minutes after injecting. You use a very small needle, and this will induce an erection. Disadvantages of this are you have to inject a medication into your penis. There is a risk of what we call priapism, where the erection lasts too long, over 4 hours, and you may need to visit the emergency room to have this taken down. You can have pain at the injection site. It does require teaching. Long term, it can cause some scarring and can cause a condition called Peyronie's disease or curvature of the penis. And some men just don't want to stick a needle in their penis to get an erection, and that's okay. We have other treatment options. Next, we're going to touch on some of the more surgical managements of erectile dysfunction. First is the malleable penile prosthesis, and this is basically two malleable cylinders that go inside the penis, inside the erectile bodies, and they are constantly, we call them semi-rigid, so they're always semi-hard. When a patient wants to be sexually active, they bend their penis to kind of like this picture here. When they don't want to be sexually active, they bend the penis down or up, and it's hidden. It's totally concealed by the body, so nothing's outside of the body. It's the least expensive prosthesis that we have on the market. But some disadvantages is it doesn't feel very natural because the penis is always semi-rigid. It stays firm when you don't want an erection. It's just bent into position, bent into a non-sexual position. And lastly, we'll touch on the inflatable penile prosthesis, which is the gold standard for refractory erectile dysfunction. Advantages of this device is it's easy to use. It's totally concealed by the body. And the biggest thing is that it reestablishes spontaneity. When a patient wants to be sexually active, they can. They don't have to worry about a pill or a shot or a vacuum. And when they don't want to be sexually active, they push a button and the implant is deflated. I'm going to show a video here in a second, which explains this in a little more detail. So hopefully you all can understand that. So give me 1 second to get that loaded. So this will go over just the different components. There's cylinders that go in the erectile body. There's a reservoir that goes under the abdominal wall, and there's a pump that goes in the penis. When a man wants an erection, he pumps the pump that's in the scrotum, and fluid is transferred into these cylinders within the penis. It gets very firm and rigid, and it's going to stay erect as long as you want it to stay erect. When you're done with intercourse or sexual activity, there's a button you push and then squeeze the penis, and all that fluid goes back up into the penis, into the reservoir, and the penis goes flaccid. So it really mimics the natural erection of getting hard, getting soft, getting hard, getting soft, really just when you want it to be erected, when you want it to be soft. So these are some frequently asked questions we get about penile prosthesis. One is the sensation for me and my partner the same? Will I orgasm and will I have ejaculation? And the answer to all these questions are yes. The sensation is the same. It's going to feel the same for you and your partner that normal intercourse would. Orgasm is the same. If you are able to ejaculate now, you would be able to ejaculate with this device. The only difference is the mechanism in which you get an erection. So instead of taking a pill or doing a shot, you're going to get an erection from manipulating this pump and pumping fluid into the cylinders in your penis. I'm going to show a patient testimonial real quick, and then we'll finish up the presentation and take some questions. So I'm going to load that up real quick here.
Hi, my name is Stan Rydelic, and I'm 61 years old, and I live in South Carolina.
I'm Teresa Rydelic. I'm 60 years old, and I met this gentleman when I was 15 years old, and we've been together ever since.
I've been married to my wife, Teresa, we've been debating this, 39 years. 39 years. 39 years.
October.
39 years of bliss. About three and a half years ago, I ended up getting ill. I thought I had the flu. It turned out that I had complete liver failure. And so unfortunately, or fortunately, I had to have a liver transplant. As part of the procedure to nourish my liver, I found out what they did is they rerouted some of my blood flow. And so I ended up with a condition called arterial insufficiency, which basically means that the lower part of my body had insufficient blood flow. After I had my liver transplant and I was feeling well again, and then I found out that things were not happening romantically. It was kind of a surprise. So what I did was I asked my general practitioner, and so he immediately says, well, you know what? All you need is some Viagra. So what he did was he gave me a prescription for Viagra. I went home. I remember that evening, I was thinking, oh, how wonderful, Viagra. Of course, it's going to be a great evening. So what I did is I put some music on, poured some wine for my wife, lit some candles, and guess what? Nothing happened. So I went back and, and every time we're going in, it's just like it's 2 weeks or so between, appointments, and it's still like nothing's happening. And you start to really get very discouraged. So the doctor gave me a choice. He says we could use vacuum erection devices, he says, or we can also use an injection. So I said, well, let's try the vacuum thing first. That was horrifying. Well, first of all, in my opinion, it was horrifying. It didn't really work. So that was like a one-time shot. And then we tried it was Trimix that I tried. And so I thought that was going to be great. Went home, and again, since there was a tiny bit of success, I thought this was going to be a great evening. So you try to get all romantic, and then you say, oh, excuse me, honey, I have to go into the bathroom and inject my penis with Trimix. I did everything that I could, and quite honestly, I had never even heard of a penile implant. And so when this doctor I went to, he was a young gun, kind of like, cutting edge, and he says, I think the only thing that we could do, he says, to really guarantee that you can get an erection is a penile implant. So Teresa was a part of the process. She came to the doctor's office with me, and what we did is we had the discussion about it, penile implant, and she said, look, if it means that much to you, she goes, I want you back how you were. I want you happy. A couple things came up. The first one that I worried about was the procedure, a painful procedure. And quite honestly, I was told, and after experiencing it, it's an outpatient procedure. It takes less than an hour, in many cases a half an hour or less. Another thing that concerned me also, and this one's going to sound really, really very strange, but I really worried that I would have the desire to have sex.
Well, it's kind of ironic because that's exactly how I felt. I felt like, well, he's going to get this implant. We hadn't had sex in so long. Maybe that chapter's over. And I think that a lot of women worry that they're not going to be ready for this new adventure like they were. And it actually has been a renewal of our relationship in one area. And so I'm glad. I'm just glad it's freeing. It's taken on where we can be spontaneous, just so different than years before.
There was a romance.
Yeah.
There was a spark that was put back that we didn't know went out. The thing that's really, I think, been wonderful with an implant, with the implant, which I honestly, I don't consider I have an implant anymore. It's just, it's a part of me.
Right.
There's no, well, first of all, from the standpoint, if you look at me, if you saw me in the shower or whatever, you cannot tell that I've had an implant at all. And then also from the other standpoint is you have complete spontaneity. There is never anything where you have to say, okay, you know what, I'm going to take a pill and wait a half an hour for it to happen. If if you're in the mood, you're in the mood.
Right.
And I mean, it turns back the clock. I mean, I honestly feel like we're in our 20s or 30s.
Since the implant, there's a confidence there that is actually very sexy. And that confidence is something that I think the implant did for us. And I don't worry that it was me, that maybe I wasn't something that he was needing. No, we're perfect for one another, and now we have back our love life. If I could give some advice to someone dealing with this, a couple dealing with this, I would say talk to one another, be honest and open and loving, because the answer may be no. The answer may be, no, I don't want to do this, and it may be, I've been thinking about this. So I think communication is the key.
If I could give a piece of advice to anyone suffering from erectile dysfunction, it is the fact that you have one life, and you have the choice to choose how you live your life and at what level of quality you live your life. So if you're suffering with something like erectile dysfunction, that's fine, you can live with it, but you don't have to. It's something that is so easily fixed, and you could have the quality back in your life that makes you a whole person again.
All right. So I've been answering some of the questions in the chat box here, but I will finish the presentation and take some more questions at the end. So moving on, every surgery we do has risks. So let's talk about the risks of a penile prosthesis. The biggest risk of placing a penile prosthesis is the risk of infection. The risk of infection in a non-diabetic patient is about 1 to 2%. And the risk in a diabetic patient is probably a little closer to 3 to 5%. And this is very similar to, if you were to have a hip implant, a knee implant, a pacemaker, these all can get infected. But there's a lot of things we do, and over time with the technology and the antibiotic, you're able to coat these in the antibiotic of your choosing. The risk of infection has gone way down, and I quote patients about 1 to 2%. The device can malfunction. 90% of these devices will last more than 10 years. So they are very, very, our goal is to get you something that you can have sex with for a long period of time. And I've seen these last over 20 years in the past. So I'm getting a lot of questions on insurance coverage. So this is a, medical procedure that is prescribed by your urologist. It's completely covered by most major insurance plans, including Medicare. And we have some reimbursement specialists in our office that can help confirm your coverage, based on your insurance plan if this is something you're interested in. You always know of any out-of-pocket expenses that you're going to have before you have the surgery, but most of these are completely covered. So if anyone's interested in an appointment, the easiest way to schedule is to send an email to menshealth@uabmc.edu. If you include your name, phone number, and date of birth, we'll email you back, and we'll try and get you in for a priority appointment as soon as possible, because you all were at this webinar. If you don't want to use the email, you can call the number 205-996-8765. That's our just UAB urology scheduling line. Again, thank you all so much for being here. I'm going to answer some questions before we end. All right. So I'm getting a lot of questions on shockwave therapy. So shockwave therapy is a new investigational and experimental treatment that's on the market. Currently, our guidelines say this should only be used as an investigational therapy because the data is lacking on it. It does have some good data in men who have mild erectile dysfunction, so men who maybe are on pills or something like that, but not men who pills are failing. And it works only really for men who have what we call arterial insufficiencies, so blood flow issues to the penis. So it's from something to the nerves or the veins. That shockwave is not going to help those patients. And I would caution you all to be very careful on where you go to get this, because there's a lot of men's health clinics out there that are not offering shockwave the way it's supposed to be done, and this is really just a huge cost with no benefit. Getting a lot of questions about risks to surgery. So the biggest risk, like we talked about, is the risk of infection, about 1 to 2%, and slightly higher in diabetics or patients who are on some type of immunosuppression, like a transplant patient, just because their immune system isn't as strong. Success rates are greater than 95%. About 97 to 98% of patients say that they're happy with their device when we look at some of the literature, and they would recommend this procedure to a friend. So getting some questions on how safe the procedure is. This procedure is very safe. We do these every week, and they're very, we have very good outcomes here at UAB. This is done in the hospital, but most patients go home the same day of surgery. So no overnight stay in the hospital. Typically, you'll be seen at 2 weeks just to make sure your wound is healing appropriately. And then somewhere between 4 to 6 weeks after surgery, we bring you in to teach you how to use your device, and you're able to go have sexual relations and sexual intercourse. So getting a lot of questions on just how many of these we do. Like I said, we do these every week. I would say we're a very high volume practice here at UAB and feel comfortable handling, the difficult cases and the very straightforward cases. Getting a question on vacuum and suction method. It is successful in a lot of patients. It's just there's a lot of patients that don't really like the penis can be cold, and ejaculation can be affected. So someone asked about what is the device filled with. It's filled with saline. So for some reason, if the fluid were to leak, it's not going to hurt you, or it's not going to cause any harm to your penis or your surrounding organs. It's just not going to get as hard if the fluid leaks. But that is very, very uncommon with these implants. They're very reliable. Like I said before, a lot of insurance questions. Medicare does cover these, as does most major insurances, and we can help you determine if you fall into that category, if that's something you're interested in. Getting a lot more questions on how many we do here at UAB. I can't speak for some of the other physicians, but I do a majority of these, and I'd say we do between 100 and 150 of these every year. So what does the evaluation workup consist of? That really is very patient dependent. Definitely would involve a clinic evaluation. Some men, just based on their history and what they've used in the past, as far as erectile dysfunction medications, we can tailor a treatment option, and they may be a candidate for an implant just based off that first initial discussion. Others, we try on some other medications, and in some patients require a penile Doppler, which we offer here at UAB, which looks at the blood flow, but that's not needed in all patients. Another question I'm getting a lot is, do you have to necessarily do injections to be a candidate for a penile implant? The answer is no. Typically, most of our men who have this have gotten this device, they've at least failed pills, as long as they're a candidate for pills. Some men, based on some cardiac medications, heart medications, are not a candidate for pills. But we typically like to start with pills because they're not invasive. But some men really don't want to do injections. So there's no problem going straight to an implant after failing pills if someone doesn't want to do injections and doesn't want to do a vacuum. The implant is very safe. It cannot cause other diseases or cancers or anything like that. The biggest risk, like I said, is the risk of infection, about 1 to 2%. So yes, so this is a good question here. Is the solution in the pump it's taking over for the natural blood flow? And the answer to that is yes, exactly. So these cylinders in the penis will fill up with fluid when you pump the pump, and that mimics blood flow going into the penis. So it mimics the natural erection. I'm going to scroll back here. Just a lot of people are asking about how to make an appointment. Here is the appointment email. Email is a little faster just because we can get you into clinic a little faster, but feel free to call too if you want to make an appointment that way. What diseases can cause poor blood flow to the penis? That can be any cardiac issue. So, if someone has any kind of heart issue, even high blood pressure, high cholesterol, diabetes, all these things can affect blood flow. Someone asking about infections. Does that mean that sex is over? No, not necessarily at all. In the event of infection, and luckily we see this very rarely, the device has to be removed. Sometimes we put a new device in right away, or other times we have to wait for the infection to heal a little more and come back and put a new one in a couple months later. So getting questions on immunocompromised patients. So we see this very commonly, stem cell transplants, kidney transplants, liver transplants, HIV patients. We have done implants successfully in all these patients, and happy to talk with you about that in clinic if that's something you're interested in. I'll keep this open for another minute, and if there's no more questions, we'll end the webinar. And again, thank you all for being here tonight. All right. Yeah, a couple more questions here. So the size of the erection is really dependent on the patient's anatomy. So all these implants are custom fit in the operating room. And my promise to patients is I'll put the biggest implant in that your anatomy can handle, but this is not a lengthening procedure. We can't make your penis bigger with this. Erections should be very close to the erections you've had in the past. So what's the oldest patient I put one of these in? We've put these in patients in the 90s. We think age is really just a number. As long as a patient's healthy enough for intercourse, and it's something they're interested in, and we're happy to treat them, whether it's with an implant, with pills, or with injections. So talking about the surgery in a little more detail, as far as downtime after the surgery, like I said, you go home the same day as surgery. Patients are able to drive a couple days after surgery. The big limitation after surgery is just no heavy lifting for a couple weeks, because we want the reservoir to kind of scar into the correct location. And similar to other procedures, you don't want to lift heavy to cause a hernia. We don't want the reservoir to move locations and herniate. But some people go back to work a week later, a couple days later, really depending on what you do and how active you are at work. And within a couple weeks, you're feeling pretty much back to yourself. Getting a question, this is a great question, a question about curvature. So yes, the implant does help with curvature. And one of the treatments for Peyronie's disease is a penile implant. So the implant will help with curvature. And there are some other adjunct or procedures we can do at the time of surgery to help straighten the penis, if need be, in patients who have curvature and erectile dysfunction. Again, most men are using their implant somewhere between 3 and 6 weeks, depending on your specific case and the technique we use during your case. We can talk about that in clinic at your appointment. All right, I'll leave it open another 30 seconds, and we'll close down the webinar for tonight. Thank you all again for coming. Okay, so a couple more questions about the procedure. The procedure takes anywhere between 30 or 45 minutes to an hour. The implant is never removed unless, like I said, you have an infection or some other issue. However, typically most men don't ever need this removed. Will prostate surgery have any effects on the length of my erection? So the the short answer is it can. Over time, men, if they don't get erections, such as after a prostate cancer surgery, they can have some penile shortening due to just poor blood flow over time that can cause scarring. The good thing about the penile implant is once you have a penile implant, the penis will not scar down anymore. It will remain the same size. All right. Well, thank you all and have a good one.